who drink a cup of coffee a day, about 40% less likely to have an irregular heart rhythm episode than people who avoided caffeine. That's at least according to new research. We've got physician executive director of cardio at MedStar Heart and Vascular Institute, Dr. Zayd Eldadah. So good to see you and have you join us. Before we get to the study here, which is fascinating, let's talk about AFib. For people who may not know, what is atrial fibrillation?
Sure. So very simply, it's nice to be back. First of all, atrial fibrillation is a very common heart rhythm condition in which the heart's electrical activity becomes chaotic. So a normal, regular rhythm gives rise to an irregular, abnormal rhythm. Some people feel it, some people can't. But the risks of atrial fibrillation are there for everybody. Over time, it increases the risk of stroke, it can increase the risk of heart failure, and a number of other heart conditions. So it's something to take seriously.
And now we see this study, which is fascinating because it almost challenges the thought that I think has been prevalent among society that coffee, a known stimulant, right, it's caffeine laden, would exacerbate something like AFib. Instead, it seems like it helps. What did this study show?
Yeah, so very interesting. This is actually a study that's added to previous observation. This was a relatively small study, 200 people. 100 people were randomized to not having coffee at all over the course of 6 months. The other 100 people consumed, on average, 1 cup of coffee a day every single day. Now, all of these patients already had a history of atrial fibrillation. So what was looked at was to see whether caffeine or coffee drinking made things worse or not. And what was found is that the group that drank a cup of coffee a day on average actually had a lower likelihood of a repeat of their atrial fibrillation episode. So less likelihood of repeat atrial fibrillation versus those who abstained from coffee in this particular study.
And as a cardiologist yourself, what's the thought behind that? Is it the fact that maybe it continued electricity with the heart and therefore didn't have that arrhythmia, if you will, the pause? I mean, why would this result in that?
Sure, it's a very good question, and you were right. Actually, there's a common dogma that says, well, coffee's a stimulant. Stimulants might increase the likelihood of an irregular heartbeat. But actually, this is additive information. We've seen this before in actually larger scale trials where caffeine, specifically coming from coffee or natural sources, can probably calm irregular heart rhythms. And there are a few mechanisms for that. Caffeine blocks a certain kind of receptor, adenosine, which is a particular signaling molecule that can increase the likelihood of atrial fibrillation. So by blocking it, there's a reduction in that risk. Caffeine also, and other factors in coffee, specifically some of the coffee molecules, can reduce the likelihood of inflammation. And inflammation increases the likelihood of atrial fibrillation. There are also some secondary benefits of coffee drinking. When you take caffeine in, you might be more active, and we know that increased physical activity lowers the risk of recurring atrial fibrillation. And lastly, there's another kind of stimulation that the brain sends to the heart that coffee blocks, and in so doing, it can also reduce the risk of atrial fibrillation. So lots of plausible reasons why this may be the case, and we see it in human beings as well.
Absolutely fascinating to hear that from a cardiologist. I think when you hear that with the study and what has been, if you will, common knowledge, a lot of people may be confused here and say, okay, so what do I do? How much coffee is safe? Should I drink? So, Doc, what do you tell your patients?
This is a great question. So I think the data seems to suggest that moderate coffee intake, so 1 to 2 cups of coffee a day, if you already drink coffee and if you know that it doesn't adversely affect your health, meaning it doesn't cause heart palpitations or jitteriness or other symptoms that you don't like, is probably safe to continue. If you have a history of atrial fibrillation and you're treated by your doctors and you drink 1 to 2 cups of coffee a day, that may be okay. What we do know from studies is that very heavy coffee intake, over 5 cups a day, is probably not helpful. That can increase heart rate, it can increase blood pressure, and can increase some of the bad risks related to the heart. So moderate intake, 1 to 2 cups a day, is probably very safe.
Always valuable to get the clarity there. MedStar Dr. Zayd Eldadah, we always appreciate it when you come on the DMV Zone. Thank you.
Thanks for having me. Thank you.